everybody. My name is Dr. John Lucio. I practice integrative medicine and pain management in Jefferson City, Missouri. And welcome to our channel, J&J House Call. It's late Sunday evening, so we're in our robes getting ready for bed. And this is my wife.
Hi, I'm Dr. Jennifer Su. I practice conventional gynecology and integrative medicine. This is my comfy that I got from his oldest daughter, Sydney, for Christmas. Isn't it just wonderful? Comfies are completely fleece lined. This is totally off the subject, but I wear this to sleep every night. I'm never cold. She's pretty cool. Thank you, Sydney. If you've never joined us before, we'd love it if you subscribed. Hit the like button, we appreciate it. And always hit that notification bell so you know when we've uploaded our next video. Today's topic is actually personal. I've been affected by endometriosis. Many of you have, or you know someone who has. Typically, most people with endometriosis have female symptoms that are dominant. So just focus on that. It's estrogen dominant symptoms. And so we're talking about hormone imbalance again. And as integrative doctors, we want to take a whole body approach to helping you with this chronic condition. That's the second thing, it's chronic. So first of all, what is estrogen dominance? Estrogen dominance means that it has a lot more, it causes heavy periods, crampy periods, pelvic pain, pain with intercourse. It might even cause you to have difficulties conceiving a child. So the reason that you think, well, I thought estrogen helped me to have kids. Well, this type of estrogen dominance causes scarring. So that's why your tubes that carry that little egg into your uterus and carry the sperm up to meet the egg, they get scarred, or even the things inside your pelvic get scarred, and that's why you have trouble conceiving. So whenever you go to your doctor, typically we want you to start your regular annual checkups at age 16. At that time, they'll ask you just a general health history. They'll ask your parent to maybe leave the room for a certain period of time during it so you can talk about things that might seem more private that you don't want your parents or your caregivers to know about. And everything in our state of Missouri is confidential until, anytime you want to see us, it's confidential. So if your parents wanted to know what you talked about, totally confidential. So start at age 16, getting an annual checkup once a year. And then by standard of care by American College of Obstetrics and Gynecology, we only start pap smears at age 21, even if you've had lots of sexual partners before then. But obviously on the side subject is if you want to have sexually transmitted disease testing, we can do that at any time. You don't have to wait till you're 21. So back to the subject. You're going to be seeing your doctor. They're going to be asking you about when you started your periods. Are you sexually active? Are you thinking about conceiving? Are you on any kind of birth control? Are you concerned about STDs? Are you having any pain with periods? And they'll kind of just ask you those basic things. And that's the time to tell them if you're starting to have pain with your periods. If you're starting to have pain with your periods, we do basic things. Like we don't just jump in and say, oh, you've got endometriosis. Most likely you just have pain with periods, and we start you on just knowledge about why the periods hurt. We kind of deal with breathing techniques so that you know that pain is not always bad. In the Western culture, pain is shown to be an evil thing, but actually if you think about pain with your periods, think, oh, this is good that I have pain with periods because this is how I'm going to have children in the future. So not all pain is bad. So, but in typical Western cultures, we've evilized pain. But if you think about pain in a whole different light, it's tolerable. We learn breathing techniques, and those carry on to many parts of our life where pain in some cases is good. If you're having, though, pain that's now happening all month long, not even during your periods, you may want to talk to your doctor even between annual checkups. So what I usually do is I kind of just ask you, okay, what's the stressors in your life? And then I'll kind of go into what are your hobbies? What are things like that that drive you, make you happy? Have those been disrupted for different reasons? Are you having more stress because different changes have happened in your life? And then we'll go into what you're eating. What are your sleep patterns? So the only way to really diagnose endometriosis is not with any imaging. Oftentimes the lesions of endometriosis are undetectable on ultrasound because they're so small, unless you have a cyst called an endometrioma. An endometrioma is a large enough cyst collection of blood that we can actually see that on an ultrasound. It's pretty typical. Most of the time you can't find it. And the fourth tricky thing to remember about endometriosis is that the amount of disease inside of you that's causing your pain is inversely related. So if you have a lot of pain every month, the amount of disease that's actually affecting your organs is very little. Whereas a woman like me who had very little pain has a lot of disease. Like they went in, they found it scattered everywhere in my organs. Isn't that interesting? The inverse relationship. Amount of disease, a lot of pain. A lot of disease, little pain. So once you've talked to your doctor about different things with stress, what's your diet like? Most of the time we do start with hormone therapy to kind of test it out. We want to see if this helps, because endometriosis is just your normal period tissue that's kind of found its way in the wrong places. So period tissue is supposed to stay in the womb and you expel it once a month as a period. This tissue just kind of goes in the different parts of your pelvis, and when you're bleeding from your period, you're bleeding inside too, so that's why it hurts so bad. So what you would do is we would start you maybe on birth control pills, progesterone, because we're balancing the estrogen effects, and basically we're just trying to cause a higher progesterone environment. So if those help, then we might think, great, they probably have it, especially if we take a family history and your family members have had it, especially along the mother's side. Start asking around, hey, did any of my aunts have this? My mother have this? Did my grandmother have this? All on the mother's side. You tend to inherit it. And so what you would do is you might want to start on it for about a year or two, but these obviously prevent pregnancy. So at the time you start to want to conceive, you might have to start doing other things. Or if the birth control pills and the progesterone agents don't help, then you're going to have to go into surgery. And with surgery, what most people do is a laparoscopy, which is placing a small camera inside your abdomen and then just either burning or excising the actual lesions, and they're just like splats of tissue, the tissue that causes your periods. They can be clear vesicle color, they can be scars, they can be blueberry spots. So they're tiny, tiny little spots or just smears of this dark brown pigmentation. The more effective of the two, whether you burn them, which is called an ablative technique of buzzing every lesion and burning them, versus taking it and excising it, the excision's much better, because when you burn it, you tend to cause more scar tissue. And of the burning and the ablating and the excising, it's much better if you can find a doctor who's skilled in CO2 laser excision of endometriosis. It's much more successful, especially if you're trying to decrease your pain and to get pregnant. If you have had surgery, your doctor will most likely want to start you on some kind of agent to shut down all estrogen, and those are GnRH agonists. GnRH agonists will put you through a menopause, and it's temporary for about 6 months. So most of us will have the hot flashes. I remember having them. It was truly very distressing hot flashes because you are in menopause at that point, but not permanently. It's just for the first 6 months after they've taken all that time to excise all that endometriosis out of you. During those 6 months, you will not be able to try to conceive, and they also might help you by adding add-back therapy. Add-back therapy is like putting you on a hormone replacement, and that would be like estradiol 1 milligram every day while you're going through that, just to help you to tolerate the treatment for at least 6 months. I myself told my doctor I couldn't tolerate it anymore, but I didn't have any add-back therapy. At the end of the 6 months, then you can decide, if you're not wanting to have kids, to go ahead and be on a birth control pill again or the progesterone again. So if you listen, we're talking about a chronic illness. This is chronically going to come back. So how do we prevent it from coming back and living your best possible quality of life? It involves you healing yourself. So number one, get stress under control. Please get stress under control, whether that means breathing exercises, yoga, stretching, learning breathing techniques, meditation, and start eating an anti-inflammatory diet, and a diet that's free of xenoestrogens, which are just endocrine disrupting chemicals. And he wants to talk about that at our next week or next week's midweek check-in. So make sure you subscribe and then hit that notification bell so you know when that's up, because he's going to go into much more detail about xenoestrogens. They're all over. They're in this room. Let me try to find. There's probably something on this.
Yeah.
Yeah. Do you have any plastics? Look, the bears, all these bears have like plastic buttons. Those are all endocrine disruptors. You can go crazy. There's right there on our tripod. So xenoestrogens are all endocrine disrupting chemicals that are all over our environment. You want to try to, as much as you can, eliminate those from your environment. And you also want to eat a lot of omega-3 fatty acids, cook with olive oil, and eat a lot more vegetables, fruits, and less animal protein. It's the regular anti-inflammatory diet. So if you've done all that and you've done the diet and the exercise and the stretching and yoga and trying to control stress, acupuncture is helpful with endometriosis pain in terms of pelvic pain and also dysmenorrhea, which is crampy periods. But there's really no studies that have been done, but there's no harm in trying it. So how acupuncture works is it decreases cytokine-mediated inflammation. So again, it's decreasing the inflammation and the pain that it causes. So we're hoping this helped. Let me make sure I didn't forget anything. Okay, so you're on your way to living a better life with endometriosis. I think as a traditional OB-GYN, I covered the first half, but would have never talked about stress levels that you're under or what kind of diet you're eating. And especially I didn't know what diet to tell you to eat. So hopefully this was helpful. And next, well, he's going to talk about the xenoestrogen. So make sure you tune in for that either Tuesday or Wednesday of next week. But we are going to our first annual reunion.
Yeah, it's first annual for us.
For us.
Yeah, but it's been around for a while. It's at the University of Arizona. It's an alumni, the Andrew Weil Center of Integrative Medicine in Tucson.
We're really excited. So we're going to turn next Sunday into just a vlog, just so you kind of see that when we're there studying things for you guys, they want us to actually have an integrative lifestyle. Mm-hmm. In the mornings, we start early, like with Qigong, yoga, meditation, we get to pick. And every single thing that they feed us is from Dr. Andrew Weil's cookbook. So the hotel, which was Westward Look, mm-hmm. they actually cook what he wants us to eat. So we're following an anti-inflammatory diet the whole time we're there, and we get to participate in the things we're supposed to be doing that we tell you, because we know that our bodies can heal itself. So excited. I love integrative medicine. And we get our content from you. So make sure you keep commenting below what you'd like us to cover, and we'll do our best to cover it. Integrative medicine, we see successes every single day because we're taking the whole person and helping you to help your doctors be more successful at all your treatments.
That's it for today. You guys have a good night, and congratulations to the Kansas City Chiefs. They won the AFC Championship, and they're on their way to the Super Bowl.
Yeah!
Bye-bye.